everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Armodafinil. Its brand name is Nuvigil. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Armodafinil is an alpha-1 adrenoreceptor agonist. It's actually the R enantiomer of modafinil. The exact mechanism by which this medication produces wakefulness is currently unknown. In terms of indications for use, Armodafinil is indicated to be used in the treatment of narcolepsy. We see this medication used in obstructive sleep apnea, and it can also treat shift work sleep disorder. Aside from the labeled indications, there's also an off-label indication in that it can be used to treat the depressed phase in bipolar disorder when used with other medications. Now, before somebody was to use Armodafinil, there is a contraindication that they must clear, which in this case would just be a hypersensitivity to Armodafinil, Modafinil, or any other component of the product, and there's also some precautions and warnings that they should be made aware of. This medication should be avoided by patients who have a history of left ventricular hypertrophy after using other CNS stimulants in the past. This is mainly due to the increased risk of cardiovascular events. Serious and sometimes fatal dermatological skin reactions have occurred, including Stevens-Johnson syndrome, toxic epidermal necrolysis, and drug reactions with eosinophilia and systemic symptoms, also known as DRESS. The medication should be discontinued at the first sign of any of these occurring. Patients should be made aware that angioedema has been reported with the use of Armodafinil. Abnormal or excessive sleepiness may occur. And lastly, this medication should be used cautiously in patients who have a history of psychosis, depression, suicidal ideation, or mania. This is mainly due to an increase in risk of psychiatric adverse events. Now, once somebody is cleared of that contraindication and made aware of the precautions and warnings, and they start to use Armodafinil, they can expect to receive their dose orally, as it is available as a tablet. So if somebody is using this medication to treat narcolepsy, they would typically use 150 to 250 milligrams once daily in the morning. For shift work sleep disorder, 150 milligrams is typically used about 1 hour prior to the beginning of the shift. For the off-label indication that we discussed in bipolar disorder treating the depressed phase, they would typically use 150 milligrams once daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Armodafinil, so I'll go over some of those here now. A rash may occur between 1 and 4% of the time. Up to 6% of patients may experience a decrease in appetite. Up to 5% may experience diarrhea, and about 14% of patients may experience nausea. Dry mouth can happen as well. This happens in about 7% of patients. Dizziness may happen 8% of the time, and a headache may happen up to 28% of the time. 6% may experience insomnia, and 4% may experience anxiety. Now, some more rare but serious side effects would be those dermatological skin reactions we discussed, Stevens-Johnson syndrome, toxic epidermal necrolysis, and DRESS. Depression with suicidal ideation may occur. This can happen from 1 to 3% of patients. And we also mentioned angioedema. That's all we're going to talk about today with Armodafinil. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.